The Association of the United States Army is pleased to welcome you to AUSA's Thought Leaders Webinar Series, a webinar series featuring military leaders and contemporary military authors. Kicking off today's webinar is AUSA's Executive Vice President, General Bob Brown.
Good afternoon, and welcome to the Association of the United States Army's Thought Leaders Webinar. Thank you for joining us for today's webinar, and we appreciate your support as partners in the defense of our nation. Joining us today are Lieutenant General Walt Piatt, Director of the Army Staff, and Lieutenant General Scott Dingle, 45th Surgeon General of the U.S. Army and Commanding General, U.S. Army Medical Command. In addition, we are joined by Lieutenant General Retired Patricia Horoho, former Surgeon General of the U.S. Army and Commanding General, U.S. Army Medical Command, to provide opening remarks, and Colonel Promotable Deydre Teyhen, currently the Deputy Chief of Staff for the Surgeon General and an expert in holistic health and fitness, and one of the key leaders that established H2F across the Army. Colonel Promotable Teyhen will moderate the webinar today as well. For those of you joining us online today, please take advantage of having the panelists here to ask questions. You can use your question and answer tab on the right side of your screen to submit a question. And after the discussion, we'll take as many questions as possible. And you can also find the full bios for each panelist today in the handouts tab. Colonel Teyhen, thank you for joining us and moderating this discussion today, and I will turn the floor over to you.
Thank you, General Brown. Thank you for joining us today for what promises to be a fascinating discussion. We will kick off today's discussion with a few opening remarks from Lieutenant General Patricia Horoho. Lieutenant General Horoho is the Chief Executive Officer of Optum Serve, the end-to-end federal business of Optum and United Healthcare. Her distinguished leadership career includes 33 years of U.S. Army, for which she served as the 43rd Army Surgeon General and Commander of the U.S. Army Medical Command before retirement. General Horoho is also the AUSA Senior Fellow. While on active duty, General Horoho led a holistic approach to the health of the force by transitioning Army medicine from a healthcare system to a system for health. General Horoho, thank you for joining us today and providing opening remarks. I turn the webinar over to you.
Thanks, Deydre. Appreciate it very much. It's wonderful to be with everybody, and I want to thank the Army for allowing me to provide opening remarks to everybody. I think that having a conversation about resetting our individual health plans and following the pandemic and the impacts that we've faced on our physical, our emotional, and our spiritual well-being. And there's a phrase that we use in healthcare in the United States, and that's all healthcare is local. What it typically means is that regardless of policy decisions that are made in Washington, D.C., it's what happens at the local level. In Florida, Alaska, or New York, or hometown USA, that really matters. But I also think it means exactly what these past several months have taught us, and that healthcare is local. It's local to our hearts, our minds, our bodies, and our souls. And this broader context is certainly at the core of holistic medicine and person-centric care. It's also an attitude and an approach, and it's essential in a post-pandemic world. I've long been a proponent of the importance of sleep, activity, and nutrition, and that started as the performance triad, but it's grown into the health to fitness program. And if we are not tracking and taking care of ourselves by eating properly, exercising, and getting adequate sleep, then we're simply not performing at our best. And we aren't investing in building our defenses against illness and injury. As the 43rd Army Surgeon General, our team in 2012 began the journey of connecting the tenets of holistic medicine with traditional medicine. And this passion of combining different disciplines within medicine and caring for the whole person is something that carried over in my work at Optum Serve. and it's been beneficial during the COVID-19 pandemic. It's a life's passion to focus on the health of our nation, as health and healthcare form a strategic asset for our nation and our military. And this pandemic has shown gaps in healthcare. Those with pre-existing conditions, minority groups, and those living in underserved and at-risk communities are at great risk. When the pandemic began, we approached it through the lens of fighting a war and fighting an invisible enemy. The impact of being separated from loved ones, losing peers or colleagues, or family members, and not being able to protect them or mourn in person. This mindset helped us to develop agile, innovative, and adaptive tools. Our OptumServe consulting team built tools to acknowledge who these people are, the communities in need of support, and critically, the how and the when of supporting them in ways that are most meaningful to them. So the challenge now remains figuring out how to effectively close these healthcare gaps and prioritize care and caring to the most vulnerable of our society. The pandemic also brought the reminder that we must move from healthcare and move it from a disease response to a proactive, wellness-based model of care. While that change has started in Army medicine, there's so much more that we can be doing across all the services, military healthcare, and across our nation. One of the initial key challenges is figuring out how we can incentivize wellness and encourage alternate treatments, such as complementary medicine, holistic medicine, to prevent disease, or just to decrease the negative impact on how we live and how we love. So each year, and I know you all have heard me say this, but each year grants us 525,600 minutes. And surprisingly, only 100 of those minutes, a little more than an hour and a half, are spent interacting with the healthcare system. As we spend those 100 minutes focused on conversations about checking cholesterol levels or managing diabetes, as well as other disease management topics, together, I believe we need to shift that conversation to that very local level where people live, labor, and they love. We need to shift our focus to those actions related to life readiness, those meaningful decision points made in the other 525,500 minutes of the year that impact our overall wellness, our mental, our physical, our spiritual, our emotional, and our financial health throughout our entire life cycle. So we should change the conversation to what do you want to be doing in the coming years? What activities and hobbies do you want to be healthy enough to be able to participate in? Because the pandemic underscored for all of us the value of those minutes, the minutes together to truly live, to truly labor, and to truly love, and the importance of each one of those. Let's transition from the hour and a half that providers intersect with patients each year discussing healthcare and prioritize instead their path to life readiness, those 60 to 1,000 decisions made each day that have a lasting impact on maintaining or improving health, as well as living vital and meaningful lives. Let's talk about what we're eating, what we're drinking, how much exercise we're getting, what we're doing to strengthen our resiliency, to reduce stress, and to build our spirituality. Let's talk about what brings us joy. We need to further leverage hundreds and thousands and millions of data points to enhance in a meaningful way the relationship and partnership between a care provider and a person to increase readiness and life readiness. We also need to talk about managing our health in non-pharmacological ways. Instead of medication to treat pain, exploring acupuncture, meditation, or yoga to help with pain management. The conversation needs to be about broadening our population health intersection, to include these points of engagement throughout the life space, and to do so in individualized and meaningful ways that can help motivate, guide, and support an individual and their family in their daily healthcare journey. Because all healthcare is local to our hearts, our minds, our bodies, and our soul. And I don't think there's a person that is listening today who has not been unchanged by the events of the past 16 months. Whether or not we suffered the loss of a loved one or loved ones, we are all reevaluating our lives in a holistic way. Reassessing the what and the who is truly important to us. We're coming to grips with the fragility of life, and many of us are asking, what changes do I need to make today so that I can enjoy life for a longer period of time in the most vital way? I am grateful that you all are having this important conversation, and I stand ready to partner and support in any way that I can. So serving together, honored to serve, and I'm going to turn it back to Deydre. Thank you so much.
Thank you, ma'am. We really appreciate your opening comments. We will now move on to the panel, which is going to be led by General Brown. General Brown retired from the U.S. Army as the Commanding General of U.S. Army Pacific, the largest Army Service Component Command. While on active duty, General Brown really led the development of the Human Dimension Strategy, which really spearheaded the idea of the importance of investing in the human dimension, specifically ensuring that soldiers are able to thrive in ambiguity and chaos and make the right decisions at the right time. General Brown, thank you so much for coming and joining us today. We look forward to your opening thoughts.
Well, thanks, Deydre, and that was just great to hear. Patty Horoho's covered a lot, such important issues there. So we'll build on those for sure, and really look forward to the questions and answers. 3 key points I think I would like to start with and save as much time as possible for questions and answers. But I think as our Chief of Staff of the Army, General McConville says, it's people first. You know, people aren't in the Army, people are the Army. And when you, and of course, Creighton Abrams said that years ago. But when you look, you know, it's, yes, we want the best machines, we need the best equipment, the best technology, but it's the people that are our advantage. And so I think it's absolutely key and great to see that we're looking at, holistically looking at the soldier. And I think too often, I know early in my career, we looked at physical only, physical fitness, and not necessarily even the right physical, you know, kind of, I'd have better knees if we did the physical fitness we're doing today. But holistically looking at the soldier, and it's certainly the physical is important. You have to, you know, have to be in the best shape possible, and fitness is absolutely key. I'm not, obviously, but there's more to it. And I will really emphasize mental readiness. You know, being a soldier is tough. It's a complex world, and we're asking more of soldiers than ever before in history, and more situations where they're isolated, they're alone, and where they have incredible decisions that they have to make, and a lot of pressure, and requires a lot of initiative. You can't get there without a holistic approach at ensuring soldiers are ready, and the mental readiness is a key part. And in that, we have to get where they have access to the care they need. So I'm so happy to see in the Holistic Health and Fitness Program, 28 brigade combat teams getting that access to that care they need down at the brigade level. That's fantastic. But then it's going to take a lot of work from all to eliminate that stigma of getting help. There's still a stigma out there if you need help, and you know, you'll see things, in my experience in combat, that humans should never see. You know, terrible things, and so you need to get that help, and not just in that situation, but when you need it, you need to have the expert there to help you. Another one is spiritual readiness. I think absolutely a key pillar. And if I can read a quote from George Marshall, it was back from 1941 when he was speaking at Trinity College. He says, "The soldier's heart, the soldier's spirit, the soldier's soul are everything. Unless the soldier's soul sustains him, he cannot be relied on and will fail himself and his commander and his country in the end." And the only thing I would change to make that current today is he and she. You know, but boy, was Marshall spot on. And that was 1941. He understood that. And I know that when you talk to spiritual readiness, immediately some folks will say, "Oh my gosh, they're pushing religion." No, it is a foundation, a purpose. It can be religion, it can be many things, but you have to find out what it is and give people the opportunity to build that spiritual readiness. It's so key within our system. So I hope we get some more questions on that, and I know that it can include everything from mindfulness, which I think we'll talk about a little later, that spiritual readiness, to journaling, to setting goals, and different ways that people, and religion is one of them, but there are others as well. And finally, I think there's a key thing. We still have issues out there where, is it readiness or people? Where do I, and there seems to be this divide between readiness, all the gates you have to go through, and the many things that are extremely important. We have to be ready, obviously, but I would say it's people are readiness. And it's not readiness or people are readiness. And so that holistic health and fitness program that's developed and efforts across the Army are so key, because they help get at the readiness for those soldiers that will carry out the mission and be the most important part. And it really gets at prevention, which I feel like, in the past, we had sort of looked at, we'll treat as folks get injured, we're reactive to things when there's a problem. But when you look at the holistic health and fitness program and the efforts going on across the Army, and this push is spot on, because it gets at preventing before it happens. Once you have an injury, boy, it's awful tough to come back. And there's some folks, I saw it even in basic training, they're getting injury because we didn't ease them in the right way to running or whatever it may be, and you lose them the rest of the time. You don't get them back. And so across the board, that holistic effort is key. And really to get at, as you mentioned earlier, thriving in ambiguity and chaos, optimizing human performance is what we need to succeed, because winning matters. What we need to succeed in the future is optimize that human performance where folks can thrive in ambiguity and chaos. But that takes a holistic approach. So I look forward to the questions, and I'll stop there so we have time.
Thank you so much, General Brown. As we think about what General Brown said and General Horoho, it really was their partnership with the Human Dimension Strategy and the Performance Triad that laid the foundation for where we are today. And part of that success really came from the work General Piatt has done, specifically, and let me introduce him first. So General Piatt is currently the Director of the Army Staff, but really why he's here today is because of all the work he's done to advocate for soldiers' mental health and wellness, while also improving their decision-making on the battlefield by what he's done in writing on mindfulness, and really understanding how important it is to be mindful for the cognitive and mental health of our soldiers and the decision dominance that we need for multi-domain operations. So General Piatt, I turn the floor over to you.
Oh, thanks, teacher. Sir, thanks. It's an honor to be here, and thanks for doing this. And soldier, we all know the importance of fitness. We're going to talk about that a lot. And when the Surgeon General tells you to get your sleep, eat your vegetables, work out, so you know how to do it, it all fits together. It makes sense. You know what to do. But I didn't know where to go to get our mental fitness. But it was in 2010 where I learned how to do push-ups for my mind. And that's when I was a brigade commander serving in the 25th Infantry Division in Hawaii. We were on the every other year deployment cycle. We were going there and seeing those and experiencing those horrific things, sir, that you talked about. And we were coming back, and we would see that our stress was manifesting itself into very, very harmful behaviors. And we were desperate. We wanted to try something new on our reintegration. And that's when I met Dr. Amishi Jha and Dr. Elizabeth Stanley, that wanted to do a study and help us on using a mindful fitness-based approach to help reduce stress. And we thought this would be a great way to reintegrate. And what we quickly learned was, well, this is something that we should be doing before we deploy. This is preventative. This is about improving your performance, not about just reducing stress. And I was hooked from the get-go, and we did a study of 200 soldiers within the brigade. I didn't make the cut. I didn't make the team, so I had to do it on my own on the sidelines. But I instantly noticed a difference. I went home to speak with my wife, and before, I was not really listening. I was hearing, but I wasn't really there. I was formulating a response, telling her how I was going to solve these problems she was putting on me, because that's what I did. I solved problems, but I actually listened, and I heard a beautiful voice, and I heard someone that wasn't really asking questions, but was communicating to me, and it was really just after practicing just a very few times, doing my push-ups for my mind, I started to see what I wasn't seeing and what I was missing. And playing football with my son, Josh. He said, "Dad, you're not on your BlackBerry." We used to have those things. Deydre, I don't know if you're old enough to remember, but he noticed that I was there. And then I realized that how many times wasn't I there? And how many times was I living in the past deployment, getting ready for the next one, and I wasn't taking full advantage of those precious minutes that I had with my family. And I realized this was applicable to all our soldiers. We do go and do very, very horrific things for our nation, and sometimes you're in moments of sheer terror, but you can't displace those. You have to be there. When things are at their absolute hardest, you need to be there and be there without judgment. And if you're not, in my mind, you're not qualified to respond. And it's the same in the Pentagon. It's the same with all the stressful jobs many of you have and still have and have had. We need to be there without judgment. Mindfulness allows you to do that. And it is, I call it push-ups for the mind, but it's really, doing, 12 to 15 minutes a day doing nothing. We dedicate hours a day for physical fitness. We dedicate hours and days for training to be able to do our combat missions. The Army needs to carve this time out because it is the most absolute critical start. And we completed that study in 2010. We've done many, many more. And I'm convinced because the science shows that this is not some hocus pocus. The science is showing from the many studies that have been done, many from Dr. Jha that I've currently mentioned and University of Miami, her lab is showing results, and we're showing that we can increase performance in our soldiers by doing this. We always want to increase performance through technology. We need to just start really with ourselves. And it's not just about being a better soldier, it's really about being a better person, but that makes us, I think, better soldiers, better leaders. We listen to our subordinates. We're not just telling people what to do, and we're in that moment, and when we're asked to give our best military advice, we're actually ready to do it. So I look forward to the questions too. This is an exciting forum, and thanks for having me.
Thank you, sir. I really liked your comment about being present, especially with your family. They say happiness can't occur over the cognitive horizon, right? I'll be happy when my kids go to college. I'll be happy when I get married. I'll be happy when I have grandchildren, right? All those things are over that cognitive horizon. And it was really nice to see how important it was, not just for where we go to war, but in the present and our families and those we love, which brings back to General Horoho's comment. Which takes me next to our third panel member, which is Lieutenant General Dingle. General Dingle is the 45th Surgeon General of the United States Army and Commanding General of the U.S. Army Medical Command. General Dingle is transforming Army medicine with a focus of readiness of soldiers, leaders, and installation. General Dingle is currently at Fort Hood, Texas, and is joining us remotely. General Dingle, the floor is yours.
Well, Deydre, thank you so much. I love this. So as General Brown and General Piatt and as Lieutenant General Retired Horoho have discussed, what they've said in essence is that the soldier is the Army's most prized weapon system. That's what I heard. And it reminds me, I love the quote that says, the strength of a nation is its army, the strength of the army is its soldier, and the strength of the soldier is its family. And to me, that brings to mind that soldiers must have that emotional intelligence, the balance of that performance triad, to ensure that their physical health and fitness, and that they're also using that intelligence to make those right decisions to ensure that all that is in an equilibrium as they look at the foundation of health and success of their various missions. And so with that said, it is clear to me that a soldier's health is truly the foundation that enables what we often call readiness or soldier readiness. And where Army medicine is pivoting to, historically our motto, is to conserve the fighting strength, and we know that. But that also requires that our force is a medically ready and fit force. And that starts with each and every individual soldier. Now, this is going to require Army medicine to do several things, and this is where we're optimizing, because what we want to do is support our soldiers, leaders, and every last one of our installations and communities. And we're going to do this from a three-prong attack. One is soldier support, two is leader support, and then the third one is community support. And from a soldier support perspective, every leader, as we know, has the responsibility to ensure that our soldiers are physically, mentally, and emotionally ready to deploy today, fight tonight, and to return to duty tomorrow when called upon. Or as the chief says, people first. But there's also two major challenges that we struggle with when it comes to soldier readiness. One is that musculoskeletal injuries and behavioral health conditions. These continue to be, speed bumps in the road to readiness that we must overcome. And what we're doing in Army medicine, and you mentioned it earlier, Deydre, is that we are embedding, our healthcare professionals into Army units forward to help early identification and early treatment to ensure that they are ready and able to return to duty with the limiting amount of profile days missed. Some of those embedments are embedded behavioral health, embedded physical therapy, the holistic health and fitness. That embeds those OTs, those occupational therapists, physical therapists, and dietitians, along with a suite of civilian professionals, all forward on the tip of the spear to support our soldiers. And then we can't forget from the TRADOC perspective, our TRADOC optimization of medical services to take care of our soldiers. Also, in support of our pregnant soldiers, we can't forget that, Army medicine is doing a tremendous job in supporting the installation, pregnancy and postpartum PT programs and centering pregnancy. Now, nearly 70% of the soldiers that are enrolled in P3T have been given overwhelming rave reviews and how it helped them to return to duty after pregnancy and getting them ready to pass that PT test. The second point is leader support. MTF commanders, our medical treatment facility commanders, also wear the hat of Director of Health Services for an installation or community. And so that means that every commander, every hospital medical treatment facility commander is there to integrate services across the entire installation to support our soldiers and leaders. They're also playing a heavy role in the installation's Community Ready and Resilient Council as they synchronize those services and support the battalion and brigade command teams to ensure they got the tools, the knowledge, and the wisdom to optimize soldier readiness. And then finally, Army medicine in support of the leaders are also there to translate data into wisdom for those command teams and leaders so they can better understand the medical readiness and to help them make good decisions. And then finally, the third prong approach is from a community support. That holistic support that was talked about earlier also entails our community. Fundamentally, readiness starts at home. And although the Army recruits soldiers, they retain families. Again, the strength of the nation is its army, of the army a soldier, the soldier, its family. And so to that end, Army medicine is partnering with installation leaderships across the CONUS and OCONUS to help, them make those healthy choices, ensure that we are keeping in balance that performance triad that came from, again, that 43rd Superstar Surgeon General, General Horoho. And I tell you, we're taking an all-of-Army approach to improve access to healthy foods and healthy choices. And I'm very excited about that. So in closing, from, me as your 45th Surgeon General, even as we transition, the military health system, and I get a lot of questions about it, as your Surgeon General, my role remains as the integrator, the facilitator, the advocate, the ambassador, the consultant, to advise and, the enabler of the health of the force. And that is not change, and that will not change. And as soldiers get ill or injured, we will remain focused on restoring combat power by returning soldiers to duty to ensure that they're optimizing their health, their choices, as well as their mindfulness, as General Piatt talks about, to ensure we get a good holistic perspective. And then again, although there's a lot changing in Army medicine, we're focused on readiness, and I'm excited about this major pivot to readiness in support of our soldiers and our families. Deydre, I look forward to answering questions.
Thank you, sir, so much. Before we pivot to the question and answer session, I would just like to remind you all that these three leaders presenting to us today are also authors, and the articles that they published that were the foundation for this Thought Leaders Forum is posted in the handout section on the website. The first question we have today goes to you, General Brown, and it says, what has been the greatest success in how the Army operates since you helped develop and publish the human dimension concept in 2014?
Yeah, no, thanks. I think what we've heard today, holistic approach. This was not the norm just a few years ago. We would not include, when you look at the fact that we have FM 722, holistic health and fitness, and they cover mental readiness, spiritual readiness, sleep, nutrition, and then of course physical fitness in a way that is the best I've seen of how to ensure you get fit without breaking early. So I think that holistic approach, it went from kind of the exception to the norm, and folks understanding that because our soldiers are our greatest asset, and we've got to ensure they're ready and take care of them the way we should. And so I would just say that really makes me proud to have been a part of that and to see it continue. And folks have taken, to levels I never could have imagined. So, and I would add folks sitting right here and General Dingle and Horoho, their work is unbelievably impressive, and what General Piatt's done, and of course, Deydre, what you've done with the whole thing has been just fantastic. So, yeah, definitely the holistic approach, and that is the norm.
Thank you, sir. The next question, General Piatt, is for you. And you talked about the importance of mindfulness for the warfighter. I was lucky enough to live across the street from a battalion commander at 25th ID who credited mindfulness for the success of his command while he was deployed. And he thought that he was a better commander because he was taught how to integrate it. From your perspective, how important, what are the roles and how important is mindfulness for the Army warfighter?
Yeah, I think it's essential. Beyond important, it's absolutely essential. Our soldiers operate, live in very complex and chaotic environments, and you need to be able to be there without judgment. The research has shown, the science has shown that mindfulness increases your ability to pay attention. It also helps you reduce stress, two things that we're very, very familiar with in the Army. And you put soldiers in very difficult situations and they have to make decisions in split seconds that could have strategic impacts and could result in life or death. You want them to be at their very best. You don't want them to be thinking about the mistake they made and maybe they did something wrong yesterday or caused something to happen to a friend, or be thinking about something back home, or thinking about what they need to do tomorrow. You need to be there. So the applications in combat, I think, are very real, because we are warrior athletes. Athletes want to be able to see the ball, not hear the thousands of fans cheering for them to miss it, or cheering or counting off how many seconds they have left before they shoot the ball. What they want to be able to do is see the task at hand, and they want to be at that moment to be able to do it. And we are warrior athletes. It's essential and directly applies, but more importantly, all the research is showing that these benefits, are allowing you to operate at your very best when things are at their very worst. And think about then the applications of coming home. If you're regulating stress, pre-traumatic event, you're not allowing it to build up, that could manifest in harmful behaviors that we see our soldiers experience. So it helps with redeployment, reintegration, your family time, your mental well-being. To be able to be there with your family, listening to your wife. I highly recommend it for husbands. Listen to your wife. Our spouses have beautiful voices, and you're just to be in that moment. It's just improved my life. And soldiers, all of us, our family members too, we live very hard lives, but it doesn't have to be hard. We can be there, and this technique is just so essential. But you don't take my word for it. Read the research, and the science is pointing us this way, and so it's absolutely essential for soldiers.
Thank you. Our third question is for you, General Dingle. As Army medicine pivots to readiness, can you explain Army medicine's role in ensuring the mental and cognitive health of the force?
Wow, that's a great question. Thanks, Deydre. Our role as Army medicine, me as a Surgeon General, as I mentioned earlier, is to be that integrator to ensure that our soldiers and our families are getting the behavioral health care that is optimized and that is world-class in support of their requirements. This continuum of care is what we call that behavioral health system of care. It's a continuum of care that starts with prevention, trying to build resilience and that grit to ensure that we're optimizing decision making, helping us to work through challenges. We work with the Army Resilience Director and TRADOC's holistic health and fitness programs to ensure that we're getting after, that resilience nugget, that is so important in our lives. The next step is the early identification and intervention. The earlier that people seek care, when they're in a crisis, the better their outcomes. And so to that end, what we're trying to do is we're working with our chaplains. We've partnered with them and our military family life counselors and even our own embedded behavioral health, soldiers and civilians to help us identify, who would benefit from care and to ensure that they get care early, trying to get past, the stigma and the fear, of seeking help and care. Then it gets into evaluation and treatment. If someone has been identified as needing behavioral health care, what we do, again, and our medical professionals are great at it, is provide that evidence-based care to help them get back to recovery, to get back to normal, to get back in the right state, physically, mentally, emotionally, spiritually, that they were at prior to the incident. There are several specialty treatment strategies that we leverage. Whether if it's individual or group therapies, whether if it's intensive outpatient, inpatient, or even residential substance use clinical care, it is all designed to ensure the best approach and treatment, again, for our beneficiaries. And then finally, the rehabilitation and reintegration. Although we hope that all soldiers will be able to return to duty and to continue to get after the mission that they so dear love, sometimes for the good of the soldier, it's determined that they must enter the individual disability evaluation system. And just because they enter that IDES system because they were determined to be unfit for continued service because of a medical issue, it does not mean that Army medicine ceases to support that soldier on their path to wellness. We have always leaned in and will continue to lean in to support the reintegration of every soldier back to civilian life, coordinated with the VA, to ensure that it is a smooth transition. So that continuum care, that behavioral health system of care, continuum of care, is been identified as one of the nation's best in support of our soldiers.
Sir, along those lines, we got a question from Jenny K, and I'm going to paraphrase it a bit, but basically Jenny's asking, what really is the difference between when we moved behavioral health and embedded them in the unit versus the traditional model where behavioral health was just only in the brick and mortar MTFs? Really, what have you seen as the real benefit of moving these providers out into the units?
Well, what that means is we're taking it to that, what we call in combat, that point of injury. We're going far forward. Instead of them having to come to our facilities, that point of care, we're taking it to them. So we're embedded far forward. We are closer to the soldier. We are closer to that impact or where the need is most required, where they don't have to leave that location, but we're going to them. So we're taking it to their location.
Thank you so much, sir. The next question comes from Gina, and really we'll go to General Piatt. Is the practice of mindfulness introduced as early as basic training, and how prevalent is it now implementing mindfulness across the Army?
Well, we're actually doing a few pilots from across, so from entry-level training with TRADOC all the way to our senior executive level training with our general officers and nominative sergeant majors and throughout, but it's not prevalent enough. And I invite you all, everyone listening today, you can start practicing today. It doesn't cost you anything, and you can put it into your daily routine. But we are doing some really good studies, and I think the research will show from at least completion of these studies that this is something we need to do. And it's been, we're very excited. The TRADOC commander, General Funk, was very open to this idea. Everywhere we go, people, once they hear about it, a little bit of skepticism. What is it? And they push back a little bit. But once they try it, and they see that, okay, this is something that can help me improve my performance, improve my life, improve what I do. But I seriously invite everybody, why wait? If the Army makes something mandatory, I've seen a lot of things where we try to make something a program, and sometimes we don't do all the best with it. This is something that, after my physical fitness sessions every morning, I just sit down for a practice. And it doesn't take, even if you only have 5 minutes, it's better than anything. Even working in the stress of the Pentagon, not a lot of stress there, right? So go out and just do a mindful walk in the courtyard and just take some time to just be at that moment, at that time. Don't multitask. be there, do one thing at a time, and you'll find that you do one thing a lot better than you do 50 things try to do simultaneously. So we're going to get there. It's not there yet, but a lot of good work being done across our military education system, all the way from entry level to general officers and across the force, and work done with special forces as well.
And I just wanted to, I got to see it in practice, the mindfulness, when General Piatt was in Colonel Piatt and in 25th Division. And it is amazing, the level of, just a small amount of time, because time is always a precious asset, of course. Oh, here's another thing added to our rucksack. How are we going to do this? Well, when it's incorporated right with fitness, and it's more holistic fitness, you have time for it, and it makes a huge difference. And I also I didn't get a chance to jump in, Deydre, on the embedded behavioral health. I had the benefit of doing some pilots on that and seeing the results of embedded versus, where they're located at the health facility, be it the hospital or clinic. What a huge difference when they are embedded, the behavioral health professionals. It's just like your chaplain who's down there doing PT with the unit, accessible, and you get to know what the soldiers are going through. They get to see you. It makes all the difference in the world of their access and their ability to seek help and kind of help get rid of that stigma we've all mentioned a little bit, because they're there with you. They understand what's going on, and it just makes a huge difference. I was really happy to see, again, Army moving that way. It's quite an investment. But at least 28 brigades so far starting off with that. It's fantastic. And it's up to 37 people. So that's not easy, but it's really important, and it will make a huge difference.
So this next question, I'll open it up to all three panel members, but really we've talked a little bit about the holistic health and fitness and really kind of the current model. This Steve asked, really, what is the role of spiritual, relationship, and financial fitness? And really, although it might not fall under the H2F umbrella, what have you guys seen that has worked on your installation to really try to grow those relationships, financial fitness, and spiritual fitness?
I'll start with the spiritual is under H2F. It wasn't, there were some issues, again, as I'd mentioned in the beginning, but I think it's very important that, there are a lot of studies. There's been, in fact, some great work by Dr. Lisa Miller at Columbia University, and she's working with the chaplains on the spiritual aspects. And again, it's not just religion. It's what is the purpose for a person, having that faith in the way, having the opportunity, the freedom to exercise it the way they need. And it's been proven that it will reduce harmful behaviors, and in particular, a reduction in suicide when an individual has that spiritual foundation. I mean, a proven effect. So that is part of holistic health and fitness, which I was very happy. It's there, it's got physical fitness, mental readiness, spiritual readiness, sleep, and nutrition are all the pillars. Now I'll let Walt take the relationship and financial, handle other ways, and I'll let Walt do that.
Sure.
Talk about that.
Well, I think these are all stressors, and there's many stressors on our soldiers and family members, and this holistic health approach allows you to deal with the stress. You mentioned it before. Some people think I'll be happy when I get more money, and so the money may not be the issue. It's the stressor. So learn to be in the moment. Mindfulness practice gives you acceptance as well. And so the stressors are maybe you're bringing them on yourself. So bringing all this together and understanding it. But we see a lot of harmful behaviors when it comes to relationship stressors in the Army. That's one of our leading causes, sadly, for causes of suicides when you see what happens there. And I'm not sure I'm not suggesting mindfulness or anything is a cure to that. There's much we don't know about suicides, but we do know when relationships are stressed, there are ways to get the help you need. And that's why a holistic health approach has to take in all the stressors that are impacting our soldiers and families' everyday lives. It's not just the stress of combat. You just can't come back and turn it all off. Life is full with many stressors, and we need to give them the tools to be able to, for leaders to be able to recognize that, for individuals to be able to help one another, and these fit, disciplined, cohesive teams that Army senior leaders talk about so much will help our soldiers be able to deal with the stressors because the team is recognizing the impacts of those stressors.
All right, so for the last question, which I'm going to combine two into one just based on time, But at least what we have seen as we rolled out the holistic health and fitness is the different programs the Army's invested in actually getting integrated better, right? And that integration not only helps with time, but financial resources to run these programs and make them successful. I guess as you look at this and you think about the resourcing of investing in our most prized weapon system, the U.S. soldier and their family members, how do you think that we should be thinking about this to make sure that we get the best return on investment and we make sure that that investment is solid?
I think we just commit, we double down, and we just understand it. We got this right. Integrating all these programs are right. I caution folks, let's not be prepared to grade or judge or try to look for outputs yet. It's the right thing to do. Follow the science. That's what's going to lead us there. That's what's going to tell us that these type of fitness, it took a long time for physical fitness to be accepted by people, that if you run, it was actually good for you. So from my line of work, what I'm advocating for, mindfulness, we're still in cotton sweatpants, but we're going to get there. Follow the science, take the lead. And these, we are right. The Army is right on this. And we just have to not let, resources be obstacles to us. These things can be done with very minimal resources. It's the expertise we need in the people that surround this. And we've got to give ourselves time. If you don't have time to take care of the individual, then why are we saying people first? So that resource to me is a given, and we just got to continue to move down this path. Sure.
Well, I think I'll let General Dingle have a chance at that. Scott, did you comments?
Sir, thank you. I'm excited because even with that question, what we've done in the chaplain and the medical community, we have what's called a spiritual readiness pilot. We used to call it the Chaplain Medical Integration Program, or CHIP, where we are synergizing the efforts of the spiritual support, to that physical support or behavioral health support for our soldiers. And so we have combined resources to better support the soldier forward. So when you talk about the H2F, one of the largest asks from commanders in the field, as folks focus on, that most prized weapon system, the soldier, has been more behavior health. And so, sir, you're absolutely right. The embedded behavior health has been skyrocketing. And then our spiritual pilot that we're doing with the chaplains, providing that spiritual behavior health, physical support forward, also is another direction, not an expansion of H2F, but services that we are pushing forward in support of our soldiers. And as General Piatt said, that is so important to help them deal with those stressors. Again, not where they have to leave and come back to us, but us doing it forward where those soldiers are at. And I'm excited about it. Over.
Yeah, thanks, Scott. That's spot on. And I think the only thing I would add is, and it was mentioned, but don't expect, where I see it's successful, the holistic approach. Don't expect, hey, here's buckets of time to do each one of these things. You have to combine it with other events. Really smart, where it's combined and you're leveraging, because there's not enough time to do everything out there. How do you combine it in a smart way to really get at holistic health and fitness with the soldiers and take care of them the way we should? And it takes a pretty clever combination of events, and then you can be successful.
I'd like to thank the panel and turn it back over to you, General Brown, for some closing remarks.
Okay, well, geez, what a terrific panel. As usual, I think we could go on another 3 hours, but we just don't have the time. So before we part, I want to inform you of a few upcoming events. On 22 July, we'll host a noon report on Army Women in Technology, featuring Major General Maria Barrett and Miss Nancy Kreidler, and sponsored by Ernst & Young. That would be a great one. I'd tune in for that. On 3 August, we'll host a noon report on Army Climate Strategy and the Action Plan, featuring Mr. Jack Sarash and Miss Amy Borman, another very timely subject, and be great to see you. Hey, the annual meeting is 11 to 13 October in person. We're all excited. It's going to be the best ever. And I'll tell you what, there's some great events scheduled. It's open now for registration, so you better sign up. Don't be late. We look forward to seeing you at the annual meeting. It's going to be terrific, no doubt about it. If you're interested in other events out there, check out our website, ausa.org. And finally, I'd just like to thank all of you who support us with your membership. Membership matters. It helps us make a difference. You help us support the Army. Thanks again to the panel, and thanks again for joining us. Have a great day.